What is bladder outlet obstruction from BPH? Imagine trying to drain a sink that's partly blocked. That's similar to what happens when a man has bladder outlet obstruction caused by benign prostatic hyperplasia. This condition happens when the prostate gland, which surrounds the tube that carries urine out of the body, becomes enlarged. The prostate is a small gland located below the bladder, and in men over 50, it often grows larger due to a process called hyperplasia, which means an increase in cell number. As the prostate enlarges, especially in the central and transitional zones around the urethra, it can physically press against this tube. This pressure narrows the urethra, creating a blockage that makes it harder for urine to flow freely from the bladder. Sometimes, the median lobe of the prostate can grow into the bladder itself, acting like a flap that can intermittently block urine during urination. This blockage causes the bladder to work harder to push urine through the narrowed outlet. Over time, this increased effort can lead to symptoms like a weak or interrupted urine stream, a feeling of incomplete emptying, frequent urination, urgency, and difficulty starting urination. Men might also experience hesitancy or dribbling after they finish. Because the bladder has to generate higher pressure to overcome the obstruction, it can cause changes in the bladder muscle, leading to urinary retention where the bladder cannot fully empty. While bladder outlet obstruction from BPH can raise levels of prostate-specific antigen, it is important to note that it is not a risk factor for prostate cancer. The two conditions are different, with prostate cancer usually developing in different areas of the prostate. Treatment options aim to relieving the obstruction and improve symptoms. Medications such as alpha blockers help relax the smooth muscle in the prostate and bladder neck, easing urine flow. Other drugs called alpha reductase inhibitors can reduce prostate size over time. For more severe cases, surgical procedures like transurethral resection of the prostate may be recommended to physically remove or reduce the enlarged tissue blocking the urethra. In summary, bladder outlet obstruction from benign prostatic hyperplasia is a mechanical and functional blockage caused by prostate enlargement and increased muscle tone. It impairs urine flow, leading to discomfort and potential urinary complications. If you experience symptoms like difficulty urinating or a weak stream, it's important to consult a healthcare professional for proper evaluation and management. Remember, each person's situation is unique, and personalized medical advice is essential for effective treatment.